Hi, I'm Vikram Devaraj. I'm a plastic surgeon and also one of the senior lecturers here at the University of Exeter Medical School. Yeah, they do boob jobs, some of them, and that's part of the aesthetic range and repertoire that we do. But most of what I do as a National Health Service doctor, consultant, is trauma and cancer and other reconstructive surgery. We have a private practice and I also have a university practice. So it is a myth to presume that's the only thing that they do. Some people have a full-time private practice, in which case they might do a lot of aesthetic work. It's partially true. I think when you're in your training years, there is depending on the specialty you choose, there are going to be times when your spare time is fairly limited, and that's to be expected. And high demand specialties like plastic surgery, orthopedics, pediatric surgery neurosurgery will certainly limit the available opportunities you have to spend time with your family, but the rewards are superb. And I would say anybody who feels like going into a specialty that is all embracing, all parts of the body, all ages, giving you a massive palette in terms of reconstruction, it's a fantastic place to be. Yeah, it's really important to have a balance in everything you do in life. So in terms of my work and both academic and as a surgeon, you've got to have time to balance that to get your brain and your health and your body back in order. So I have an interest in martial arts, in particular Wing Chun Kung Fu, do a lot of walking, I shoot, and I also do a bit of running, just run the London Marathon for Starlight, fantastic charity locally, which is based, and we have patients on our ward in Bramble Ward who benefit from Starlight's input. It's for children with cancer who are terminally ill, and it grants them wishes and all sorts. So it's great to have a mixture of these things, which keeps me sane. A surgeon, depending on what level of training you are, certainly have to lead, you have to show by example, you have to make decisions quickly, you have to be able to work within a team, as all doctors do really in today's modern practice. The great thing for me about being a plastic surgeon is that I have no fixed boundaries. So in terms of my list, I might be operating on a leg, I might be moving up to an area around the groin, I might be operating on a breast, I had a problem in the neck, a problem in the head. And it's wonderful to be able to do the aesthetic side too, because that can make a huge difference to a patient's life. Outside medicine, in addition, you can get involved in all sorts of things that really help structure the way medical education happens, teaching happens, in terms of the patient experience. Would I do it again? Absolutely, in a heartbeat. And I'd choose plastic surgery because I also have the luxury of being able to work abroad for various charities. I've been to Africa 9 times now, to the Congo, Uganda, Rwanda, and having that skill, that palette, where you're not confined to a particular part of the body, is wonderful. Think really hard about is this something you want to do. It's not an easy choice. It's hard enough getting into medical school. It's a bit of a lottery at the moment. You need to get the grades, you need to work really hard, you need to be very diligent, you need to present yourself well, have a good personal statement, and it's very easy to start writing, I want to care about people and so on. But you really have to know that medicine is something for you to do, because there are so many other easier choices. I do think it's completely worth doing, and if it's for you, just go for it. Don't let people put you off, don't let them dissuade you. The rewards are massive, not just personal, but more importantly for the patients that you're going to look after. It gives you a passport, you can work anywhere in the world with that passport, and it's a job for life. So don't worry about what's happening with junior doctors, don't worry about what's happening with health economics. People are going to get ill, they're going to get sick, and if you can help that one person, it makes a massive difference, so stick with it.